The Executive Director of the National Primary Healthcare Development Agency, NPHCDA, Dr. Faisal Shuaib, has assured all federal government workers of enough COVID-19 vaccines that will cover more than their population. The assurance follows the Presidential Steering Committee on COVID-19 directive for all federal government workers to be vaccinated before December 1, 2021. Shuaib, while addressing a press conference in Abuja to give an update on the vaccination process, noted that the directive is part of measures to ensure that workplace is safe for all citizens. He also disclosed that more supplies of vaccines will be expected in the coming days via the COVAX facility and the African Union.
There's a loss of productivity and its impact on socio-economic development when workers are unable to come to work on a regular and consistent basis due to outbreaks of an infectious disease such as COVID-19. Following advice from public health experts, the Presidential Steering Committee announced that all federal government employees should make a choice as to how they can contribute towards making the work environment COVID-19 free. This provision is applicable to all federal government institutions and employees. The decision to release this advisory was not taken lightly. It is part of the Presidential Steering Committee and the Federal Ministries of Health drive to always use scientific evidence to make decisions for the benefit of all Nigerians. As we enter into the period of intensive vaccination, with more vaccines arriving in the country, it is my hope that more people will turn up at the vaccination sites to be vaccinated so that Nigeria can rapidly progress towards attaining herd immunity.
The NPHCDA boss also spoke on plans to decentralizing COVID-19 vaccination in Nigeria.
I'm glad to inform you that we have commenced the process of decentralizing COVID-19 vaccination in Nigeria to include private healthcare facilities. This is what we promised during the first phase of the rollout. This is what we are delivering on. We have always made it clear that we wanted to be sure that our programs and our models were going to work in the government institutions, secure the integrity of the program before we now decentralize to the private sector. This is exactly what we're doing right now. The process of involving the private sector will be transparently done and in line with our pledge of accountability to Nigerians as we work with the subnational entities.
Dr. Shuaib also warned Nigerians against illegal acquisition of the vaccination card, saying that necessary actions will be taken against defaulters.
We are cognizant of the fact that some unscrupulous elements will want to get the card and not the jab. We are working with relevant security agencies to make examples of these individuals who may wish to buy or sell cards by ensuring that we name them and we shame them. We are also enhancing the security features of our vaccination cards in order to limit forgeries.
According to Shuaib, a total of 5,246,523 eligible populations have received at least one dose of COVID-19 vaccine, and 2,546,094 eligible persons have been fully vaccinated in Nigeria as at October 14, 2021. The agency has, however, urged Nigerians to continue to observe the non-pharmaceutical measures in order for the country to overcome the pandemic as soon as possible. Palang Bukar, CNN News.